the people who are coming in are healthy people. Clearly then we have to be very careful to make sure that what they're getting from the study is benefit rather than risk, and that the benefits outweigh the risk. We have a series of questions that we ask them designed to pick up people who might be at higher risk of side effects from isoniazid.
Isizathu esidalela uba ndize apha kwaThibela kuba ndiye ndafunda kubantu abangaphambili abalinyazwe yi-TB abayifumana emgodini ne.
Leo ba setho sa Thibela TB hobane ke ne ke sa batle go le nna ke tlo tshwarwa ke TB.
Ka hoba kgale ke sebetsa di-mine mona ke bona batho bangata ba tshwarwa ke TB. So lebaka le nkisitse mo ke lona la go ke thibele TB e se ka ntshwara le nna.
Mna ndivuye kakhulu akho nto izawundehlula ngoba ezi pilisi ze-Thibela TB.
It's one of our greatest challenges apart from recruitment. It's actually getting people to continue taking INH for 9 months. So people need to be motivated. We have a number of things that we try to do. We give incentives of small value every month when they come to collect their medication, just to say thank you.
And every month we need to see them to check to make sure that they haven't now got active TB, because that would be really important, because then we would need to treat that and cure it.
We do screening first, just to check for a few things, basically whether we can continue giving them INH and whether it's still safe to do so.
The interventions that we're doing in and of themselves are not that expensive. They're interventions that require personnel, people to go out and find TB cases, and clinical personnel to give preventive therapy for TB. The isoniazid is very cheap. Our studies are very expensive because we're collecting the data and proving the point. Doing research is expensive.
We do a number of activities to try and motivate them to continue taking INH for 9 months. We have some fun with them. We play music, we dance, we laugh. We try to interact with them and just have fun, but bring the message across that they need to come back and take INH for 9 months. With that event, we also have local TV players that were very popular. They perform a play for us. It's a script that has been written by Thibela, but they play it so that, in a way that the minors can understand.
From this study, we've learnt, firstly, that it's possible to implement this intervention. I think a lot of people thought that this was something that we wouldn't be able to do.
We are having some remarkable success in terms of the proportion of the workforce taking up the intervention. We are now achieving uptake rates close to 90%.
We've also learnt that this can be an important way of picking up people with active TB.
We have, over a period of just over 2 years, enrolled more than 27,000 individuals onto the program, screened them for tuberculosis, and started Isoniazid Preventive Therapy.
In giving mass preventive therapy, we're not harming people. We have no evidence of side effects that are unexpected or untoward. We've had no serious problems with people having toxicity. And we've seen no evidence that it produces drug-resistant TB, which is a concern that some people have.
If it does work, we would also consider implementing this intervention in other settings, such as within the military, in agriculture settings.
For example, prisons might be a situation.
What we hope to show through our research is that intervening in new ways at a community level is effective. Now, why is that important? It's important because the traditional public health approach to tuberculosis, we wait for people to get sick with TB, then we treat them. We know that's not working. To change the paradigm and say that we have to do interventions at a community level requires evidence, and so we're trying to accrue that evidence.
Many health systems, particularly in Southern Africa, are really struggling under the burden of so many people with TB. And it would be obviously a huge benefit to them if we could somehow just get that back under control. So then they could focus on doing some of the other many very important things that they should be doing. The discussions that we've had with participants suggest that people find this very empowering, because this is something that they perceived to be a major threat, and now they feel that there's something that they can do about it.